about you? What have you seen?
Yeah, it's kind of this overwhelming lack of appointments in outpatient right now. I know in primary care, an urgent visit, you're looking at a week plus to be able to be seen. Specialty care is just as bad. We refer some of our patients to other specialties, and we're getting messages back saying, well, we can see the patient in April. Well, that's over 6 months from now. And there's no other real options for some of these patients. The options then become either you overwhelm the urgent care in the ER, or you just sit at home and suffer and suck it up and wait that 6 months or wait that week to get in for your urgent care visit. As Deb said, we all are very interconnected, and in my department in particular, we rely really heavily on imaging, so on CAT scan, on MRI, to treat and diagnose our brain tumor and brain bleed patients. So that means that when they're short, we can't take care of our patients. So now I'm having patients that are calling that have a history of a brain tumor, and they're calling and they're symptomatic, and they're terrified that their brain tumor's back or that it's growing. And I have to say, I'm really sorry. I know that this is really scary and one of the worst moments of your life right now, but we can't help you until you get new imaging, and that's going to take 3 months. So then their options are, again, to wait in the ER, which radiology is already backed up, and it's not considered an emergent life-threatening issue. So they're looking at waiting 12 plus hours in an ER bed to get that imaging, or because the ER is so short-staffed, they can't even get into an ER bed. So they sit in the waiting room for 6 hours and then just leave, and just don't get the care at all. And they feel abandoned, and they feel like they're not getting the care that they deserve and the care that they need. And as the person that's on the triage phone, having to tell them that these are their options and give them this, we can't get you in for your imaging, it feels like I'm the one that's abandoning them. And that doesn't feel good, and that hurts a lot. The patients don't care about the projects. They don't care about the things that we're going to do years from now. Those are great, and I think that there are a lot of things that we can look to the future to help build the organization and help take care of our patients. But today, right now, they care about the fact that they're not getting the care that they deserve, the care that they need, and the care that we promised them.